Hi, my name is Ashley Gullett and I'm in the ADN program FSCJ, and I'm going to be performing the nasogastric tube insertion today. First, I would just check my medical record and see what the doctor ordered, the type of tube, the size, what it's for, all of that. And then I would gather all my supplies, go into the room, identify my patient by asking them their name and checking their wristband, telling them who I am and what we're going to be doing today for the nasogastric tube insertion. And then I'm going to assess the nares for any occlusions or anything, assess the oral cavity, make sure everything's okay for insertion. And then I'm going to measure where the tube placement should be by starting at the nares, going to the ear and to the xiphoid process. And then I'm going to tape that so that I know where it needs to go. And I'm going to set that aside. I'm going to wash my hands, apply some gloves. I'm going to put the towel over the patient. Make sure that they're up enough. This is good for me. And then I'm going to lubricate this using the lubricant. And then I'm going to start inserting the tube. I'm going to ask the patient to lean their head backwards and just to be patient with me as I start inserting. And then I'm going to make sure it's curved downward and start inserting back. And then I'm going to check for any curling, in the throat, and I don't see any. So I'm going to keep going. I'm going to have them lift their head forward and keep inserting. And this is giving me trouble. There it goes. Nope, it doesn't go. Seriously. Anyways, I would just keep inserting it until it got to the point where it was where I measured it. And then I'm just going to tape it. I would just tape it to the cheek or something like that. And after I tape it to the cheek, I'm going to check for placement. And I would do that first. I could do that by aspirating. And then I'm going to listen. The towel's here, but I would remove the towel and everything in that gastric region. And I can hear the gurgling. I would also check the pH of some of the aspirant and see how that was. Also, the best way is an x-ray. Also, you can ask the patient to speak and check with the pen light just to make sure there's no coiling and it looks good. Then I also would be asking them to sip as I was inserting the tube to help it go down. And then after that, I'm going to tape it to the bridge of the nose and then down around the tubing on both sides. And then I would take another piece of tape and take it across the bridge of the nose just to secure that. And then I'm going to use this rubber band and I'm going to anchor this to the patient's where they have some room with a safety pin. I would anchor that right there, and then I would attach it to the suction, and I would document the tube placement, the time, the date, if there was any aspirant and all that, the drainage color and all that kind of stuff. And then I would irrigate, and I'm going to stop right there.